Welcome to today's presentation, Step into My Office, Fostering Mental Health Support for Athletes. My name is Shivani, and I'm one of the managers of mission initiatives here at the National Eating Disorders Association, and I'm so excited to welcome you all here. I'd just like to take a brief moment before we get started to talk a little bit about the work that NEDA does. So NEDA is a nonprofit organization working to fundamentally change the way eating disorders are understood and treated, and to empower those affected to achieve lasting well-being and recovery. Through campaigns like Eating Disorders Awareness Week and through our Campus Warriors program and EDCare's events, we're working to increase public understanding of these complex disorders. We provide information and resources through the Grace Holland Cozy Resource Center, which includes our coach and athletic trainer toolkit, which we'll be talking about later today, and webinars like this. We promote early intervention through our online screening tool, which is available in English and Spanish, which has helped over 1 million people. We have also invested in groundbreaking research that helps to develop effective treatments. If you'd like to support our work and more programming like this, we'd appreciate any donations, and I'll include a link in the chat later on. So this webinar is presented to you in partnership with EDCare. EDCare is a privately held organization with more than 24 years of experience supporting patients, families, healthcare professionals, and communities in the treatment of eating disorders. With locations in Colorado, Kansas, and Nebraska, EDCare offers integrated levels of care to ensure seamless transitions and consistent support throughout the recovery journey. Taylor Smith, our presenter today, represents Athlete Edge, a Denver-based program within EDCare designed specifically for athletes ages 13 and older. Athlete Edge provides intensive and compassionate treatment from professionals who understand the unique challenges of sport. By combining physical, mental, and emotional care, the program helps athletes navigate performance pressures while working towards lasting recovery. To reduce barriers, EDCare provides no-cost housing at all locations and accepts most major insurance providers, including Colorado Medicaid and TRICARE West. Now I'm super happy to introduce you to our presenter today. Taylor Smith serves as a mental performance coach for the Athlete Edge program. Taylor gained invaluable insights into athletic performance and teamwork through his participation on a varsity swim team, in addition to 7 years as a competitive swim coach. He is enthusiastic about working with athletes and focusing on equipping them with the skills necessary to recover and maintain recovery from an eating disorder, while also helping each individual excel in their respective sport. Taylor firmly believes in the importance of sports and mindful play for personal well-being, emphasizing that sports should always be enjoyable and fulfilling. And if you have any questions throughout the presentation, please feel free to drop them in the chat feature, and I will share them at the end during a period of questions and answers with Taylor. And I will now turn it on over to you, Taylor. Please feel to take it away, and thank you so much for being here and sharing this important information with our community.
Awesome. Thank you, Shivani. Let me just get everything set. All right, everyone's able to see the screen. Oops, got ahead of ourselves. All right, so thank you for having me. Again, my name is Taylor Smith. I'm the performance coach here at the Athlete Edge program in Denver, Colorado, as part of EDCare, one of our 3 locations, but the Edge program is only here in the Denver area. And I just kind of want to just be able to invite everyone to just hopefully listen and be able to open yourselves up to the idea that mental health can definitely be at the forefront of a lot of athletes' day-to-day life, whether it being disorder or maybe something less significant, and how we can hopefully all, regardless of what our role in the eating disorder world is, really step up and help those athletes that we work directly with. So the reason I wanted you all to be able to step into my office is because I think stereotypically that is one of the, when athletes, I know when I was an athlete, when you hear that invite from coach and everything, I think stereotypically there's more often dread than like, oh, I'm about to get help and let's go talk about something exciting. And so one of the overall takeaways that we'll hopefully get to throughout this presentation is the idea that we're going to create this environment to support them and that they don't have to have that dread when we're being invited to that office. So some of the things we're going to get through today are, again, this is being sponsored by NIDA, as well as, like here we're EDCare. So we want to hit on eating disorders and a little bit more than that, and kind of some of like we'll get into the warning signs, the risks and everything that athletes and eating disorders have. And then we're going to get into like the like, like what needs to change and then how we ourselves can start to support it. But just to kind of start things off, a quick survey question for everyone here is, what are some of the occupations that we're currently here, like coaches, athletic trainers, who are we, and what athletic populations are we working with? As well as like what levels are we working with?
We have an athletic trainer from a D3 college, a health educator of college students. There's a lot of people. Sorry. A recreational therapist at an inpatient mental health facility. We have a dietitian pro sports.
So yeah, seeing quite the trend of counselors, as well as Shimani said, athletic trainers, coaches, dietitians.
We have a college mental health professional in D1.
So another curious question for y'all is like, what do our day-to-day relationships look like? Are we just kind of like, we just see them for practice and that's it? Or do we only see them on an as needed basis? Like, how are we building this relationship and this rapport with them?
Someone sees runners in counseling for their eating disorders. Rehabilitation treatment hours. They have daily interactions with folks. Promoting mental health through a club that they advise for athletes. Most
Okay.
relationships are built through rehabilitation and patient care hours, but they also have quality relationships through working practices. Some scheduled one-on-one meeting times with teams.
So as we can kind of like are hearing and seeing, like we definitely are starting to get a sense that like we're having all different types of like connections and relationship for those students. And as we're going to get through closer to the end of like how we support everything, we're going to come back to this, that everyone really is going to have a role to be supporting these athletes. It's not up to any one individual. And I know we have like our whole counselors that were speaking up in the chat. And while, like I work with a lot of great counselors, I know many from, like past centers I've worked in, like it doesn't have to be all in their hands. It doesn't want to be like, it doesn't have to be that handoff of like, oh, here you go, fix the person. Like this is going to be a team approach. So we're going to get to. But before we get to that, one last quick question. we're done with the surveys. Just kind of like a bit of a fun fact trivia thing here. We'll test your knowledge that you might already have with EDs. What are the most susceptible athletes to eating disorders?
Immersion gymnasts, individual sports, sports where body is on display, such as runners. I see figure skaters and dancers, endurance athletes, sports with weight classes like wrestlers.
All right, so we're definitely hitting the entire spectrum of athletics. And it was a little bit of a trick question. Well, we do have statistics to show what some of our top ones are. Uh, no one is immune. Eating disorders do not discriminate. Like every type of athlete on this slide that we're seeing in front of us, almost everyone I think named each of these sports. And I can say I've worked with an athlete in each of these sports as well in the eating disorder context. There are factors that we're going to get to in 1 second that affect this stuff. But again, getting back to the idea that they do not discriminate, like all genders, ages, sports, social economic statuses, body weights and sizes, sporting demands, none of this is going to say like who gets an eating disorder, who doesn't. There is, when we kind of emphasize more additional pressure and value to different types of body sizes and shapes of this is a good athlete, this body's a good athlete, this body's not a good athlete, then that's when the athletes do then obviously kind of start to feel the pressure. So just kind of get the top 5 out of the way. We have rowing, gymnastics, figure skating, cross country, and cycling. Those are the big 5 that we end up seeing the biggest biggest blah blah blah, what's the word, populations of what athletes with eating disorders. So what are some of the factors that go into there? It again comes back to like what is being valued. So if we're in a sport that's valuing low body mass, like we see endurance sports such as, again, I saw swimming and running named on there. Cycling, again, is one of our top 5. These sports require and value that maybe sometimes smaller body, or because that smaller body's less movement to move through the water, less movement to run with, less movement to be on the bike. We don't want to ignore the weight classes that were named. I know wrestling and weightlifting and various different martial arts all are going to have these demanding weight classes. And I think that's, at least for men, one of the stereotypes that some people might look at is wrestlers. You see, it's like, okay, like, there's always that demand. I don't have this here. I just know it's off the top of my head. About 80% of high school wrestlers surveyed have said that they have tried to manipulate their body weight and size to meet a weight class. And oftentimes, while not all 80% are necessarily using eating disorder behaviors, it can easily lead into that again when we have those additional pressures. Of course, we don't want to ignore the ecstatic sports. Again, like we've gymnastics and figure skating and dancers are sometimes, and unfortunately, those stereotypes that people might think of immediately when it comes to dancing. But when there is that emphasis, as someone said in the chat, of body images and just body on display, that is going to add things. Another one that sometimes goes under the radar a little bit is anti-gravitational sports. So things like pole vault, high jump, climbers, ski jumping, all of these like demands, again, it's like maybe smaller body is going to be, we're going to move up the wall quicker. We're going to jump farther off on our skis and everything. All of these are going to have those increased demands for increased risk of eating disorders, more so than some of our other categories, such as like ball sports, power sports, or technical sports. That being said, the studies that have kind of broken this down classified each sport as one given thing. So obviously we can look at some examples such as like what we have on the screen. Soccer and tennis and basketball are some sports that, you know, like require a lot of endurance. And that can also be a pretty major factor to that development of the eating disorder. I'm seeing in the chat for those top 5. Those top 5 again are rowing, gymnastics, figure skating, cross country, running, and cycling. But again, Just to finish off this and recap the slide, eating disorders are not discriminating. There are substantial risk factors in whether they're low body mass value, we're valuing that help endurance, weight classes such as wrestling and weightlifting, uh, aesthetics such as like synchronized swimming, figure skating, dance, anti-gravitational stuff, again, ski jumping, pole vault, climbing. Those are all the different ones that we're kind of going to see. And it also kind of affects like the entire culture and community that we'll get into, because if we're in a culture and community of a given sport, the environment around us that is having that external pressure to meet that specific like ideal body standard that that sport may have had or does have, then that is going to see our numbers increase. And so this is coming from several different studies that across these various studies, anywhere from 6 to 45% of all female athletes are at likelihood of having eating disorder. And that's upwards of 19. So 1 in 5 male athletes could be having eating disorder. And we also see that compared to non-athletes, athletes are at a more significant rate of having an eating disorder. And as we'll get to, that comes with all those additional stress. And while this might be kind of a stereotypical stat, is that female athletes do have higher rates of eating disorders versus male athletes. You can always kind of get into like the weeds about this one. Was like, are men being studied as much, or are they the ones asking out for help? That can go into an entirely different presentation, but it doesn't have to say that that's not great. But if we kind of look at that next one, almost 50% of female athletes in aesthetic sports, again, this is figure skating, dance, gymnastics, synchronized swimming. What else I got off the top of my head? Like, I know there's different types of gymnastics, there's rhythmic gymnastics and everything. Almost 1 in 2 athletes of those are potentially going to suffer from an eating disorder. And then when we're looking at those anti-gravitational sports, again, like climbing, ski jumping, pole vault, 1 in 5 men are at risk of having that eating disorder or might already have that eating disorder. So again, kind of like we're looking at some of those overall risks. We've already hit on like those demands of aesthetics, low body weight, weight classes, anti-gravitational. The list honestly can be endless of these factors that are going to impact the development of that eating disorder. But like other ones that we can be looking at are individual sports over team sports. Like when we look at, like the swimmers, the runners, the figure skaters, the gymnasts, like while like all in all, those things can be team sports. It's an overall team score, maybe, especially at the high school, college level. Like we're putting that extra individual pressure on ourselves because we might be like, well, this is all on me. I can't like make excuses or skate by if like if I make a mistake and other people can pick up the slack. We're looking at ourselves. And as we get higher in that demands, like when we go from high school to college and college to like, like professional, Olympic level, whatever that next level might be for individual, like the higher we go up, the more competitive we have, that's where we're starting to see the higher rates of eating disorders as well. Just again, we're looking at those increased levels of pressure, whether it be internal or external from themselves, or again, from coaches, family members, teammates, where again, just maybe those overall cultures of the sporting communities and those respective sports might have. Another one is early sports specialization. So athletes who may have picked up a sport when they were, like 4, 5, 6 years old, and them and our parents are like, well, let's run with this. And we just see how far we can get. Unrelated statistic in the sports psych world, it's kind of commonly known, like the later and later and later you stay a multi-sport athlete, the more likely you are to be an elite level athlete. So if we're just specializing one thing, that again comes back to this pressure of like, this is my everything, this is my identity, I can't let this go. And so I have to see how far this makes me. I haven't diversified myself. And so, like if I became a runner at 7 years old and now I'm suddenly like, well, now what? If I didn't make it to college, or if I'm in college and I'm not making it to that next level, what else am I supposed to do? And again, kind of coming back to some of those body expectations as well as body composition. It's the external pressure to modify and control body. People don't teach themselves these ideas to modify the body. They're picking it up somewhere, whether it's from coaches, whether it's from family members, whether it's from athletes who have done it in the past, athletes they look up to, athletes that are their teammates. it's the learned culture of the sport that teaches individuals I might need to modify and control my body composition, whether that's again in the weight classes where it's like, hey, like if I'm kind of strong but can cut my weight and be like 2 weight classes lower in wrestling, I'm going to have a huge competitive edge, and I'm not going to have to maybe take care and face off with people who are maybe more close to my what is probably our actual real body size when we're at kind of full weight restoration. Um, Other things that are going to start to affect it are, you know, like family. Eating disorders are genetic. It's like that age-old saying is that like genetics loads the gun and environment pulls the trigger. Uh, there could be a family history of it, whether it's how far it goes back. I don't know off the top of my head, but if mom, dad, sister, brother, family member, aunt, uncle had it, it's kind of there, and we're already at an increased risk of developing an eating disorder. Uh, Kind of throwing into that, more of like that family stuff is again this pressures to modify that family, which could be, you know, like where people pick up the idea of like, oh, I need to be dieting. So they're having like chronic diet behaviors as well as like exercise behaviors for the purpose of weight loss is likelihood to lead individuals into developing that increased eating disorder. We also kind of start to look at areas of like our own personality that can struggle with us. Like when individuals struggle with like low self-esteem, low confidence, these are all things that can start to really tell someone's like, well, I need to find something out. I need to find something that kind of gives me that purpose. Like, unfortunately, I've been in the eating disorder community long enough where I've met several patients who have kind of spoken out and be like, well, without my eating disorder, like I'm nothing. I'm no one. I know sometimes I've worked with therapists who have kind of created self-talk things. And even there's a therapist here in the adolescent unit who has a poster in their office. It's like, hey, your eating disorder is the least interesting thing about you. Uh, and hopefully that is definitely true. But for them, they think that is it because of they have that low self-esteem and low confidence. Uh, One other thing is perfectionism. I think many people have maybe seen in the athletic world that perfectionism kind of comes with pros and cons. Like sometimes coaches look at it as like, oh, this person's going to go the extra mile. They're going to take a like detail oriented approach and they're trying to hit everything to improve and become like the best athlete they can be. But when we're getting to that perfectionistic world, it's taking us to like that another level that we are looking at. Our self-worth is dependent on how others see us. So like if we have great outcomes, then we have good self-worth. If we start to have poor performances, then our self-worth might go down. Other people might start to treat us differently. And so we look for that additional piece of control. And that kind of comes to like this overarching idea that all these risk factors that I've just kind of rattled through over the last 5 minutes can start to hit on is that idea of control. Like eating disorders are very much about control. Like we're trying to find a sense of control in our life when we might not have a strong sense of control. So that's going to be this overarching thing that we're going to start to see more throughout these presentation. The last thing I wanted to do is kind of like running in, like kind of building off that perfectionist piece is like when we have, again, those coaches who are reinforcing those perfectionist ideas and we're focusing and primarily on that reward and that success of the performance rather than the athlete as the whole person, it comes back to the idea of like, well, coach and team only see me as, you know, like this role player on the team. Coach only sees me as this competitor and this performer. That really starts to become just who they think they are. And with that, again, comes that increased of eating disorders. All right. I'm just going to hit on this pretty quickly. If you guys go to the NEDA website, it has, and Shivani can direct people there, it has a great breakdown of all the various eating disorders. These 5 that we see in front of us, I'll kind of like do like a bit of 1-2 sentence definition of all of them. But these 5 are maybe just more like the most common ones that we might see within our treatment center here at EDCare. And I think more often the most common ones that are going to be diagnosed. There's some other ones such as like atypical anorexia and rumination and pica, like all these things that, you know, like, whoops, that can still be present. But these are the ones that we often see most. So just to try and like challenge some ideas, like anorexia being like maybe one of the most common heard ones. Unfortunately, it doesn't have a lot of great stereotypes of like, oh, like if you can see it in your body, then like they must be like too small, too skinny, like they must be anorexic. And really, like you cannot tell a person has anorexia just by looking at them. Like what we're like professionals, the clinicians, all the therapists in this chat and the doctors in this chat are looking for, it's like that dramatic weight loss, as well as combined with like a restriction of calories, as well as types of food. There might be fear of food as fear of gaining weight in there. And so that is what can kind of like be helping determine that anorexia. Body size does not determine it. However, when we do see those severe cases of anorexia, that is when we will start to see more significant medical complications that, while I can rattle through them, I'm not qualified to be recognizing them. So again, and Shivani looks like she just put in the chat, like after this, take your time, go look at it. It's very helpful. There's also a couple of subtypes. I kind of like said, like atypical anorexia. That's the one where like you're meeting some of those criteria for anorexia, such as again, calorie restriction, dramatic weight loss and everything. However, like medically speaking, your weight is within or even above that normal range that your doctor or nutritionist might, sorry, not nutritionist, registered dietitian. I apologize to the dietitians in this chat. I did not mean to say nutritionist. Might be looking for. There's also a common one that we see pretty well here is ANBP. So that's anorexia binge purge. And that's kind of where we're seeing a combination of restricting foods as well as binging and purging and everything, and kind of going through that cyclical nature where there's just like a lot of compensation. And we can also start to see a lot of medical complications. Bulimia, one of the other ones that people might be familiar with. This is more so just like the cyclical behaviors of binging and compensatory behaviors. Many people are familiar with vomiting. However, this can also be displayed in laxatives, fasting, or also very common in the athletic world, like excessive exercise to compensate for all those calories we just put in our body. And this is where we're often seeing it's not just when we're binging, we're tending to binge, like multiple meals worth of food. And that's kind of what can also bring us into BED, binge eating disorder. This is where it's discrete eating in short periods of time, and it's similar to bulimia. It can be larger than your stereotypical meal. You might be often seeing like calories that are worth multiple meals, if not an entire day worth of calories in one sitting. And this does not have the compensatory behavior that bulimia has. And there's also that decreased sense of lack of control during these episodes where we can't kind of like say or do anything about it. We're just like, this is what I have to do. These can be sporadic or they can be planned out. And that goes for like all the various binging behaviors that you might see across AMBP, bulimia, or BED. Our other two at the bottom are kind of the, I want to say newer ones, but they've been around for probably like 20 to 30 years now. Of RFID, avoidant restricted food intake disorder. This is where we might see selective ordering, not out of the fear of like weight and body size, but more so due to like just sensory sensitivity. And it becomes such an issue, like picky eating is putting it lightly. It becomes such an issue that it can lead to significant nutritional deficiencies. So you can also sometimes see this behavior common with individuals who might also have a dual diagnosis with OCD. And then OSFED, other specified feeding or eating disorder. So this one is, and Shivani might be able to correct me if I get this wrong, but this might be one of the least diagnosed ones or often most overlooked, maybe the least diagnosed, often overlooked ones, despite it kind of being just as dangerous when it comes to like overall health and well-being as like anorexia and bulimia. It does not meet certain criteria that the other ones have. However, there are still significant eating disorder symptoms. And again, it can be just as dangerous, and behaviors can, again, encompass a total mix of restriction, binging, compensation, without compensation, night eating, and more.
Yes,
Like
just
I
a
said,
brief correction about OSFID. So OSFID and binge eating disorder are actually the most commonly diagnosed types of eating disorders in the US.
okay. Sorry. Thank you for that. There's one other one I want to hit on. It is not an official diagnosis. You're not going to find it in DSM, but we do see it quite often as like this, again, secondary unofficial diagnosis, but that's going to be orthorexia. And it's kind of, it comes down to like the compulsion of checking nutritional labels, obsession about healthiness of ingredients, cutting out fats, carbs, sugars. It's this idea of like, like extreme healthy eating, but it comes down to the point, similar to ARFID, where we are not getting enough nutrients into our body because we have just narrowed down our group of approved foods. And this is where, like you're going to see some overlap again with a little bit of OCD as well as perfectionism. Uh, Again, not an official diagnosis, but quite common in the athlete world. So, our red flags, our warning signs. What can we be looking out for as we're making those like day-to-day interactions with the athletes around us? I know I saw like a lot of therapists and dietitians in the chat. Those individuals, like might be meeting one-on-one. Maybe we're doing some like maybe workshops with the athletes. When it comes down to those athletic trainers, like the strength and conditioning coaches, the athletic coaches, once we're seeing like the athletes quite a bit more, these changes kind of like we might start to see less and less just because we're seeing them so often, we might not see these drastic changes. But all these different warning signs are going to encompass several emotional, behavioral, and physical changes, such as like weight changes, frequencies and injuries, or difficulty recovering from an injury. There's just overall fatigue and lethargy coming from not having like maybe enough energy to compete and participate. There could be some medical concerns such as like lightheadedness and dizziness. Behaviors we might see around like team meals or just like how teammates might see each other is like skipping out on meals. Isolating. We're also going to see some of those emotional stuff, such as like increased irritability, depression, anxiety. Again, so much of some of those diagnoses, like we might start to see like excessive or compulsive exercise, putting in extra time in the gym, on the field, like on the court, wherever we might be. That is, again, something that's maybe historically glorified in the athletic community. So people might not think a single thing of it. And again, if we're seeing the athletes every day, like we might not start to see those weight changes. Like if we're seeing an athlete, like once a week, once every other week, like the dietitian or therapist might meet, you might see more of those relatively striking changes from week apart to weeks apart. So when we historically might fall into like glorifying, it's like, oh, hey, you're putting in extra work, great work. Or like, hey, like you've made some significant changes in your body, you're getting fitter, you're getting more in shape, you're getting like more season ready. Like these are actually some risk signs that we want to look into. Like anytime we might have some body image change, especially a drastic one in a short period of time, that can be leading to it. It's also coming down to the athlete's own preoccupation with their body image and their compensation, the composition of their body and everything like that, especially if they do check in with coach. It's like, oh, coach, like, I might just need I need to change this. I need to do that. I need about my body. Like I need to cut weight. I need to make the next weight class and everything. These are some of those red flags that we want coaches, support staff to be more aware of. Last thing I want to touch on again, this similar to some of the risks that you have as being an athlete and at risk for having increased eating disorders. This list can be a pretty long list, but I do want to hit on one thing, and that is REDS. Many people might be familiar with it. It's relative energy deficiency in sport. It's just general overall low energy availability. Kind of again, we hit on, I mentioned earlier, just like fatigue and lethargy. Like this is where we begin to see more significant medical complications that kind of worsen not just the athlete's health, we see worse performance. And this is where they're not going to maybe show up to do what is being asked of them as easily as they were before. It also affects their ability to recover. And then it kind of, again, as I mentioned earlier, we're prone to injury or difficulty recovering from an injury. All right. What are another quick survey question? When we're kind of thinking of some popular phrases that we might say to our athletes, whether we're the coach, dietitian, or therapist, definitely I'm thinking about the coaches, athletic trainers, and strength and conditioning coaches out there. What are some of the typical phrases we might use to be motivating the athletes? Striving to be a lean, mean fighting machine. All right.
Food is fuel for your body is a nice one.
Like Shivani said, food is fuel for your body is definitely a nice one. Like Renee put out the striving to be a lean, mean fighting machine. We kind of just maybe through common sense see how this can be harmful and like send a harmful message to the athletes that we're working with.
I also have don't give up, you got this.
I think that one could be taken either way. Some of like the ones that could be maybe have like a bit of like a harmful approach could be similar stuff to like my way's the highway. There's a classic one from Remember the Titans that I think is water is for winners. And then we have like pain is weakness leaving the body, kind of going back to some of those body expectations. Smaller is faster, like, or some of those ones of you go like winning isn't everything. It's the only thing. Like when we start to have these like pretty like strict expectations on a team, and this is the messaging that our team is hearing, like we definitely are having this firm hand, strong approach that doesn't necessarily leave room for athletes to interpret it any other way of like, oh, like coach wants me to take care of myself and wants me to be the better athlete. Yeah, I might want to be the better athlete, but you know, if we're looking at some college, oh, no pain, no gain, classic one. Uh, like if we're looking at some college rosters that, like I know they just passed some new things in NCAA and there's going to be some roster limitations, but historically, like D1 college football team can have like well over 100 athletes on it. And, like if you were in that, find your way to that starting position and everything, like you don't want to give it up. Like you have goals and everything. You're working towards, like a successful season and hoping, again, D1, maybe you're looking to be playing at the next level. And so like you start to see these messages, no pain, no gain, don't give up, like work through it, like my way or the highway, pain is weakness leaving the body. Like that is what becomes like our mindset. And so kind of like if anyone here has ever read Mindset by Carol Dweck, we start to see the idea that like it's really only one way. Like we have to listen to coach. Like if coach says we have to jump this high, jump this far, then we're going to do that. Unfortunately, what that can do is like that's just fueling the perfectionism that we already hit on earlier, as well as that is going to encourage us to avoid challenges because we're kind of fearful. It brings in that fear of failure. We don't want others to see us as weak. We don't want others to see that we can make mistakes. We have to keep going, and when we keep going, we have to be perfect at it. And so we are closed off to change. We're closed off to feedback. We get pretty rigid about things. We might be threatened by other success. Again, if there's like, we're got a starting lineup, we're afraid that people are going to maybe take that starting spot if we speak up about something that we need to work on. We don't tend to open ourselves up. I think one thing that I have on my list here, and I unfortunately have worked with two different athletes. They said their college training, strength and conditioning coaches had up in the gym is FYF. Anyone in the chat know what FYF stands for? Just 10 more seconds to make guesses, finalize them. Thank you, Amanda. F your feelings. If you're in a gym, if you're in an environment, you're on a team that people are saying F your feelings, are you going to feel comfortable speaking up? Not just about physical pain or anything, but definitely when it comes to like mental pain and depression and eating disorder and anxiety and any other thing that might come up that's going to cause significant distress. No, it's not promoting that safe, encouraging environment. So those are things that we want to start changing everything. So that's why we want to be like leaning into this helping hand. So uh things can be done differently. Like again, going back to like Dweck's example of fixed mindset, we also have our growth mindset. We're starting to see challenges, opportunities. We're open to feedback. We're focusing more so on the process and the overall outcome. Mistakes and failures don't have to be these limiting options and things that happen. They can be these growing opportunities. Talent can be improved. We're able to embrace stepping out of our comfort zone. And this isn't just something that we want for the athletes. This is something that all of us as these support staff also have to face. So, and not just face, but also be a part of and promote. So, like, if we're not open to change and we're stuck in that fixed mindset, we're not going to improve as a support staff. Again, coach, therapist, dietitian, athletic trainer, anyone else that's in this chat. Like, we have to begin to embrace that tough love and that like firm hand approach is not the only way to interact with our athletes, and that we can reach out and assist the athletes on more so that proverbial hole in that cliff that they might be hanging in, and really allow them to like allow us to help them. Uh, and to that, we have to kind of foster an environment that's going to support the athletes, encourages them to come forward. So with that, I'm going to get to some of these conversation starters in 1 second. This is my last content slide for you all. We also have to to foster that support, we have that team approach. So when we're kind of thinking of it, it's like a pit crew. Like here at EDCare, in addition to myself, we also have, we have our psychiatrists, we have our dietitians, we have our psychotherapists, we have our millie staff, we have strength and conditioning coaches on staff, we have our entire nursing crew, and then we have like all the managers and support staff and our kitchen staff all behind it. Like this is all the parts, these are all the parts of the treatment team. And this is like the entire approach that the athletes also need. Like we have all the different individuals in those chat, therapist, dietitian, we have athletic trainers, we have medical coaches, we have nurses, we have, medical doctors, we have the athletic coaches, the strength and conditioning coaches. Like it's going to lay on all of us. It's a multifaceted approach. It is, we become that pit crew for the athlete. Everyone has their own role working together to create this. And when it comes to many sporting environments, the thing is that coach will kind of have that strongest say. The coach can definitely set the tone and the culture. And so that's where that consistent messaging has to come in. And so athletes are people too. They're not just these performers that we can like replace if we feel like they're not living up to our expectations and standards as the coach. So we want to like intentionally create a person process focused environment. And again, it comes down to consistent measuring. We can't have the FYF posters and making jokes and statements about body image or having locker room talk or like being like, oh, hey, like, like you could, if you put in the extra work and everything, you might get that spot, that starting spot. You won't be on the bench anymore. It goes along with like, we don't want to be criticizing just like mental health or that needing the additional help. Like that's not a sign of weakness. And together we have to be, again, sharing that statement, sharing that consistent message so that athletes, when we ask them to sit and join us in our office, are not fearful. They're going to reach out. They don't have to continue to suffer in silence. That is, for all of you who've worked with eating disorders before, that's like, I think the very common unofficial slogan of eating disorders is that they thrive in secrecy. Like, we don't want them to be there in the silence. We don't want them to think they're alone. We don't want them to isolate. We want them to be reaching out. We don't want to be offended when they don't reach out. Like if we're the ones who have to make the first attempt to be like, hey, it looks like you might need to like kind of talk about something. Do you want to step into my office? You just want to check in and talk. That's where we need to really step up, make those changes. Because if we're not fostering a safe space, then the athletes are never going to feel safe coming forward. And so this, in addition to some of these conversation starters that might hit on, again, as you can see before you, there's body image, nutrition, fueling conversations, team culture, anything about like the future and identity beyond sport. It's one of my favorite topics here in our groups that we run. We can do this through, like formal team meetings. I saw like kind of in the chat earlier, like people are hitting on that. Whether it's like beginning of the season, middle of the season, you're kind of like laying that groundwork. these are the things that can come up. Let's talk about it. Or again, maybe it's those informal check-ins, especially like if someone's just like hanging out in the athletic room, like getting their like, I don't know, maybe they're getting their foot wrapped before they have to like, like go out to practice. They're getting, like they're in the ice bath after practice. Like these are the times you can be like checking in with people when people are having workshops and maybe you're seeing someone kind of like not speak up as much in that workshop, especially if they typically do speak up. So again, seeing those changes in behavior, we want to emphasize to learn who the athlete is apart from their athletic endeavors and encourage the athlete to be more than just that, an athlete. I definitely say with those nutrition and fueling conversations, anyone who's not a registered dietitian, be careful, because really I think that's something that I've heard about often, coaches making comments or even like parents making comments that might not have that education about what proper fueling and nutrition looks like. Be like, oh, I do this because my coach told me to do. Well, maybe speak with that RD and they can prove you otherwise. So, again, when we're doing those check-ins, we are going to be hearing about things about just who they are outside that sport. So that could be like how school is going, how things are going at home, like, again, who they are, like what are their interests, like what music do they listen to, what are their pets' names. I love figuring out what pets my clients have, and always kind of like following us like, oh, like how's Oscar doing? I just had a patient who had a cat named Oscar. Things that get them excited about life that it doesn't have to be about related to athletics, because again, they are more than just an athlete. So getting through things. This is launching this week on NIDA's website. We have the new coach and athletic trainer toolkit. This was put together on behalf of a NIDA board member who's also I'm fortunate to have as my supervisor, Dr. Riley Nichols. He's a sports psychologist who specializes with athletes with eating disorders. He actually consults not just myself, but others here for the EDGE program, and they've put together a revised and updated version of this toolkit specifically designed for coaches, trainers, and other athletic support staff to utilize and refer to when they see and start to notice those signs that an athlete might be struggling. I got to contribute to this a little bit, but I do not want to take credit away from Riley. This is, again, on NIDA's website. It's a free resource. Shivani just put it in the chat. So again, in addition to kind of like the different types of eating disorder link that she put in there as well, I encourage you all to check in with that link and see and take a look at how you can start utilizing some of these practices and approaches for connecting and talking with the athletes that you see. It kind of just comes down to the idea of like, like, especially why we have adolescent program now. It goes over like prevention, like that early intervention is not just for athletes, but always going to be like the best option. So offers a lot of education. So a little bit more about us. Again, we're the Athlete Edge program at EDCare, located here in Denver, Colorado. We're sports specific programming made for athletes. We're only one of a couple of different specialized disorder treatment centers in the entire country. For athletes with eating disorders, we kind of take pride that we do have our own on-site gym. We have contracted strength and conditioning coaches who are ED informed and trained, and they help me kind of oversee that reentry to sport, which is one of those things that is definitely the most difficult thing for a lot of athletes. I would say one of my biggest roles that I really enjoy here is that return to sport for them, because it's maybe similar to like that injury. Like there's going to be a lot of nerves, like a lot of hesitation to get back there into the real world where the eating disorder might have thrived. So, and those are myself as strength and conditioning coaches, again, just part of that multidisciplinary treatment team that I kind of hit on earlier. Again, psych therapists, sports dietitian, except most major insurance providers. We do free over the phone assessments. They're all confidential, and we do have housing included. I would say for our EDGE program, I think the stats are 95% of our EDGE athletes for at least the adult population come from out of state. So we do have that housing provided for them. And definitely a unique place where they can just find the care they need and hopefully begin to like just battle the eating disorder, move towards recovery, be allowed to get back towards sport, and kind of again explore that identity beyond sport. So like I was saying, we have our adult program. We have residential, partial PHP, and IOP. So that is residential is 24/7 care. We have an interesting setup. While our treatment center is not in like a traditional hospital setting, we do have a house that our residential patients get to stay in. So it's a bit of that more sense of home staying while still being in treatment 24/7. And they are always within nurse and milieu care while still seeing like the other individuals in the treatment team. PHP is that partial hospitalization. That's usually where we're looking at anywhere from 5 to 7 days a week in programming for 8 hours a day, participating groups. 2 meals, 2 snacks. This is where I think we see, at least while I've been here at EDCare, most of our athletes enter at this level of care. And then IOP is that intensive outpatient. This is where that step right before people might kind of go back to their teams, whether they're going back to college or maybe going back to their respective professional Olympic development communities. Like they're still kind of in our housing, they're working with our team, but they're out of care enough that they start to really get to challenge themselves. Like here at IOP, they're only 4 hours a day, anywhere from 3 to 5 days a week. And to highlight we've had an adolescent program for a couple of years now, but we've just in the last few months expanded our Athlete Edge program to adolescents. And so this is not restricted to those in the Denver area. However, that is where most of our adolescent individuals come from, but we have PHP and IOP programs at that level, and you get to work with the same, myself and the same multidisciplinary team that we is at the adult unit and still have access to the gym and working with our ED-informed strength and conditioning coaches. Also, some of the adolescent benefits that many people might be aware of is like education coordination. So we're not falling behind school. Like PHP is a 5-day week operation here at our programming, and for at least 1 hour a day, they are doing schoolwork so that they can still stay on track with their academic progress and goals. We also have PMIOP. And so PMIOP on the adolescent unit is actually only 3 hours a day. And it's to fit, especially for those local here in Denver, fit being in school full time. So for maybe those middle schoolers or high schoolers, depending on what their school schedule is, they could be going to a full day or almost a full day of school and then coming to our treatment center afterwards. Okay, catch my breath. Questions? Anything you have questions about that myself or maybe Shivani could have answered? I know Sherry corrected me on one thing.
Thanks, Taylor. We feel free to drop any questions you have in the chat. I have two for you already. So the first one is, how do you handle coaches who almost promote excessive weight loss or comment on weight gain? They're coming to us from a university D1 level.
So that is one of the most difficult things I think we've encountered here when we have those coaches who are basically promoting an eating disorder. It comes back to like recognizing like what your role is and looking at the idea of like controllables, like what can we control as like the treatment team, and also what can the athlete control. And unfortunately, the way you look at it is, I think there's sometimes a handful of different options. I know I've seen athletes end up being like, you know what, I've asked the coach to do some education. I've talked to the coach. Coach has been invited to family sessions, and coach is like that my way or the highway type person, and people end up transferring. The other more growth-minded way you can look at it is building that athlete up to like have that increased resiliency. So those comments that coaches, teammates might be making that are aimed at body image and everything are they're able to handle this better. They just kind of like, it's like the whole like, you're like, I'm rubber, you're glue, whatever you say bounce off me and sticks to you, right? So like we just let those comments just like brush them off, and we hopefully are able to move forward. And like if we can still let those comments fall at the wayside and thrive in that community and culture that our coaches are creating, as long as it's hopefully promotive of the athletic goals that we have, then I think that's one of the best ways to approach it. Fortunately, we can't change the coaches. It's not our role as the support staff to be able to do that. It's a challenging, but great question. Yes.
So, our next question is, how do you initiate discussion about identity beyond sport when sports is the number one purpose for the individual? Do you have any programs, references for this?
I do not have any programs off the top of my mind, but it's actually one of our groups here. So part of the Edge program here in Denver, we have 8 or 9 groups and growing. Our staff has been growing, so we're able to add more groups. And one of them is my favorite groups, and it's return to sport. And one of the first things to talk about in the return to sport is you're more than just an athlete. Like it's that identity on athletes. So be able to touch on that is really reinforcing that they have self-worth beyond being an athlete. And there's a couple activities that we do throughout that group. One is a classic one that I'm going to credit going back to Riley. It's kind of like the identity box. Everyone has a box that cannot get any bigger nor smaller. And you have your various balloons, your bubbles that can get bigger and smaller. Fill up that box. And we start to see, we draw this out or even physically do it, like get a bunch of like balloons or sports balls and everything, like cardboard box. And like when we start to see how big the athletic identity takes up that room in that box, we start to see other things are getting neglected. And so it's really being intentional and emphasizing that these neglected parts of ourself are still part of ourself. So here, like we definitely do a lot of values work here at EDCare and recognizing like how our values showing up. And so values don't have to be just connected to that athletic identity. So there's a lot of ways we can kind of be hitting on like just intentionally exploring that identity outside of sport and how even as they return to sport, it doesn't have to be the only thing. You don't have to neglect everything. So it's really a lot of just like education around what else might be in our life besides sport.
Thank you. That was really helpful.
Okay.
We have time for one more question, so related to return to sport. So, what are your general suggestions for return to sport for providers outside of Colorado? To my knowledge, the NATA does not provide a position statement for athletic trainers. It's largely up to the team physicians and care teams. So, what works well for your team, and how do you see athletic trainers playing a role in this process?
Great question. I'm going to answer what I feel qualified to answer. So our medical staff and dietary staff use SEES, SEES, that is safe exercise at every stage. And it is a multifaceted approach that hits on medical, nutritional, and psychological well-being to determining the readiness for reentry to sports, specifically with this is all developed around specifically for athletes with eating disorders. And so you can, if you Google that, I'm pretty sure you can find it's a 80-page study and like the process to go through it. It's like completely for free. Here at EDCare, our medical staff and our dietary staff are the ones who kind of hold that and oversee that. Because those are like at least the initial concerns that we don't want to address. Like we don't want to reinforce someone getting back in movement if they're not completing their meal plan and they're still like maybe they're stagnant in their weight restoration if that is part of their treatment plan. So that's something that we use as part of like our treatment team here, and we use it for every single one of our athletes from like the get-go. We kind of start to get a sense, we usually give it a week or two for all of us to have multiple sessions with a new patient, and we then start to kind of develop the idea of like what their prognosis and timeline might be for treatment, and then we are already thinking like like what could the potential reentry to sport be. But again, it's not just the dietary and medical piece; it's that psychological readiness, and so there's a couple tools that we do use that we have. I cannot think of her name off the top of my head, but there's a researcher who created the art, which I'm not going to even try and say what the art means, but I know it's an assessment that we can use that helps us gauge and have more objective data on the athlete's readiness for return to training. And that again was designed specifically for athletes with eating disorders. So the C's and art are two things that we use quite frequently here.
Well, thank you so much, Taylor. I appreciate you sharing your knowledge with us, and I hope everyone came out of this with some tools to use moving forward. I did drop the link to our updated coach and athletic trainer toolkit in the chat. I do also think it'd be really helpful to get some feedback on this webinar, so I dropped a survey link, and when the webinar closes, you should also be redirected to the survey. But it was really lovely getting all this information. Taylor, EDCare, Athlete Edge, thank you all so much for what you do. And I hope everyone has a great rest of their evening. Take care.
Thank you.